So we are doing the pulmonary system, and some facts about the pulmonary system is that the air travels through the nasal passage, down through the larynx, and down through the trachea, which splits into the left and right bronchi. Diseases of the pulmonary system can occur anywhere from the airways of the nasal cavities to the lungs, to the lung capillaries, and where the oxygen-carbon dioxide exchange occurs. And on the left you have a picture of what I was just saying about the air passing through the nasal passages, down through the larynx, to the trachea, and splitting into the right and left bronchi. On the right we have a picture of the heart. The pulmonary arteries go to the lungs, and the pulmonary veins brings the oxygenated blood to the heart, and the heart pumps it back to the rest of the body.
Chronic obstructive pulmonary disease is a lung disease that over time makes it hard to breathe. COPD includes chronic bronchitis and emphysema. Obstruction in COPD means that the flow of air in and out of the lungs is less than it should be. When that happens, less oxygen gets to the body tissues, and it becomes harder to get rid of the carbon dioxide, which is a waste of gas. COPD is the third leading cause of death in the United States.
Symptoms include shortness of breath, cough, wheezing, exercise intolerance, and decreased blood oxygen levels and increased carbon dioxide levels. So we have a picture of COPD in the lungs. On the bottom you have the bronchioles that lose their shape and they become clogged with mucus. And the top ones that are just the normal ones that are perfect and good. So, bronchitis is the inflammation of the lining of the airways or bronchial tubes. When your airways are inflamed and or infected, less air is able to flow to and from the lungs, and you cough up heavy mucus or phlegm. There are two types of bronchitis, acute and chronic. Acute can accompany a cold and it clears up after a few days. Chronic bronchitis has a mucus-producing cough. And we have a picture of the mucus in the bronchioles, which have an inflamed bronchial tube wall and an increased amount of mucus.
Emphysema makes it hard to breathe. There's damage to the air sacs in the lungs. It's hard to catch your breath. There's a chronic cough, and emphysema alone is the fourth leading cause of death in the United States.
So lung cancer is the common cause of cancer death in the United States. Lung cancer abnormal cells that cluster together to form a tumor. Cancer cells grow rapidly and uncontrollably. Cancer cells destroy healthy lung tissue. There are two forms of lung cancer, small cell and non-small cell. And there's a picture of the lung cancer with the gold tumor on the left on the bronchioles.
Asthma is when someone breathes in a trigger and there creates mucus and the bronchs swell even more than they should. Your lungs are sensitive to things that we're exposed to every day. You can get asthma at any age. Some causes includes genetics. Asthma tends to run in families. Allergies. You're more likely to get asthma if you are allergic to something. There's respiratory infections and the environment around you.
Here we have a picture of the asthma airways. On the left you have a normal one, on the right is one with asthma, which is less airway and there's more mucus. So sleep apnea is a very common disorder that causes you to stop breathing while you sleep, and from seconds to minutes. These breathing pauses often occur 5 to 30 times or more per hour. Normal breathing usually starts again, sometimes with a snort or choking sound. Three types of sleep apnea are obstructive sleep apnea. Most commonly happens when your airway has collapsed or is blocked during sleep. Central sleep apnea happens when the part of your brain that controls breathing doesn't send correct signals. And complex sleep apnea is a combination of obstructive and central sleep apnea. And some three risk factors are gender, which males are more commonly likely to have central sleep apnea than females, heart disease, and stroke or brain tumor. Here's a picture that shows the blocked airway during sleep apnea.
Influenza is also referred to as the seasonal flu. It is a highly contagious illness caused by the influenza virus. Anyone can get the flu as it is spread easily from person to person, usually when an infected person coughs or sneezes. The virus may belong to one of three different influenza virus families, A, B, or C. Influenza type A virus can infect people as well as birds, pigs, horses, and other animals. Influenza A virus can be further broken down into different strains. Influenza B virus is usually found only in humans. It is less severe contagious disease than influenza A. Influenza C virus is a mild illness in humans. Influenza C occurs much less frequently than A and B, and are not typically included in the seasonal flu vaccine.
Cystic fibrosis is an inherited disease that causes thick, sticky mucus to form in the lungs, pancreas, and other organs. In the lungs, the mucus blocks the airways, causing lung damage and making it hard to breathe. In the pancreas, it clogs the pathways leading to the digestive system, interfering with proper digestion. Cystic fibrosis is the second most common inherited disorder occurring in childhood in the United States, behind the sickle cell anemia. Approximately 30,000 people in the United States have cystic fibrosis. About 1,000 new cases of cystic fibrosis are diagnosed each year. And here we have a picture of the cystic fibrosis airway. On the bottom we have an airway with cystic fibrosis, and you can see that there is clogged with mucus and there's blood in the mucus.
Some ways to prevent these diseases is by exercise. Exercise can increase your lung function, improve your heart function, increase blood cells, and you'll have a better overall performance. Don't start smoking, or if you are smoking, stop smoking.
Some other diseases that occur in the pulmonary system are mesothelioma, pertussis, which is also called whooping cough, and pneumonia. And some more are silicosis and tuberculosis. And these are our resources.